Hello, myself Debanita Saha, Assistant Professor of the Department of Trauma Care Management, Yenepoya School of Allied Health Sciences, Yenepoya deemed to be University. So my today's topic is management of fractures. Now, before directly jumping into how we manage fracture, first we need to understand about fractures. Today's specific learning outcomes, that is at the end of the presentation, students will be able to classify the different types of skeletal fractures, then also differentiate between sprain and strain, and then describe the management of fractures, sprains and strain. So, as we all know, fracture is nothing but a discontinuity in the bone, which occurs when a huge force is applied to the bone or even due to disease conditions like osteoporosis. These are some of the common factors that affect the strength of the bone and make them prone to fracture. The first one is very obvious, that is old age. Elderly people have a loss of hormones, vitamins, calcium, which makes their body weak and makes their bone brittle. This weakening of bone, this condition is known as osteoporosis, due to which the bones are fragile and very prone to breakage. Next, even if the nutritional status, as I already mentioned, calcium and vitamin D, these are needed for bone density, bone growth. If these are not adequate in the nutrition, then the bone is prone to break. Also, if the person is suffering from certain diseases which makes the body weak, makes the immune system weak, will lead to breakage of bone. Now let's see the classification of fractures. A patient might present with different types of fracture and different types of complication associated with such fractures. So, in broad sense, we have closed fracture, also known as simple fracture. This is a type of fracture where the bone is broken but the skin still remains intact. Next, we have open fracture. We also call it compound fracture. Here, the bone breaks and pierces through the skin, that is making it an open wound. Then there is complete fracture, where the bone is broken all the way through from one end to the other end. And then there is incomplete fracture, where the bone is partially broken, that it starts breaking from one end, goes to the middle and stop, doesn't reach all the way to the other end. Then we have some other varieties of fracture. First one is transverse fracture. This is when the fracture occurs along the horizontal line of the long axis of the bone. Next we have oblique fracture. Oblique fracture is a fracture when the fracture occurs in a diagonal manner along the long axis of the bone. As you can see here, the diagonal fracture occurred, and in one of the pictures it is still intact, the bone is still in place, where the other one it is displaced. So the first one is non-displaced oblique fracture and the second one is displaced oblique fracture. Next we have spiral fracture. It occurs due to a twisting force applied to a bone. For example, someone has taken and twisted your hand, that will lead to a spiral fracture, as it occurred because of a twisting force applied to your arm. As you can see, the spiral or the twist of the fracture here in the picture, due to which it occurred. Next we have comminuted fracture. Comminuted fracture is when a bone is shattered into pieces. For example, someone took your hand and with a lot of force gave a stone into the other hand. They have attacked the hand with the stone. Now what will happen? A lot of force is applied which shatters the bone into tiny pieces, which will lead to comminuted fracture. Next there is linear fracture. So it is a type of incomplete fracture where a crack occurs along the longitudinal or long axis of the bone in a vertical manner. Then there is green stick fracture. This is also a type of incomplete fracture where the breakage starts from one end and does not reach all the way through to the other end. Lastly, we have segmental fracture. Here the bone is broken into two pieces. How it is done? Because the force is applied into two different points of the bone, which differentiates a segment from the main bone. That is, a piece of the bone is totally separated from the main segment. So, now we move on to what is sprain and what is strain. Now, any injury to ligament is known as sprain. Now, what are ligaments? Those are connective tissue which connects bone to another bone. Whereas strain is any injury to a muscle or tendon. Tendon, on the other hand, are the connective tissues which connect muscles to bone. Now, sprain results from stretching or tearing of the ligament fibers. When the ligament fibers get teared or injured, we experience sprain. Whereas overstretching or tearing of muscle or tendon fibers causes strain. Whenever we are doing heavy exercises which pulls our muscle and all, this is because of strain. Next, in sprain, it commonly occurs in the joints. As ligaments connect bone to bone, so it is a joint injury. It occurs in the joints. Whereas strain occurs in areas with high muscle and tendon stress. Whenever we experience muscle spasms and all, it is all because we are experiencing a strain. As you can see here, the sprain is where the ligaments are there, it occurred in the ligaments, joints or around the bone. Whereas strain is occurring in the areas of high muscle tension when there is a muscle pull or muscle spasm. Next, we go to the assessment findings, that is the clinical findings which we will see in a patient who has been presented with a fracture. The first and foremost thing we will be seeing is pain. Definitely pain is one of the factors when it is related to fracture. Next, we have deformity. The original anatomical position of the bone is displaced, which will deform the structure of the fracture due to the fracture. Then we have abnormal limb positioning. As the deformity occurred, then the positioning of the limb where the fracture occurred will definitely be abnormal. Next, there is muscle spasms, as it is already discussed, because when the bone breaks, it might affect the muscles, it might cause injury to the muscles and stretch the muscles too much, which will lead to muscle spasms. Then there is color changes including pallor and cyanosis. That is due to the decreased blood flow or accumulation of blood under the skin, we see the skin becoming pale or becoming cyanotic, that is bluish discoloration of the skin occurred. Next, we have point tenderness, that is we feel pain on touching certain affected areas. Next, we see the principles of general management. Now, management of fracture is not an easy process, but there are certain principles or certain methods which are applicable for most of the fractures. So, we use the mnemonic RICES for emergency medical care of fractures, sprains and strains. The first element of RICES is rest. What it means? It means the person or the limb which has been fractured needs adequate resting and movement should be restricted to the minimum. Next, there should be ice compressions. Ice compressions should be given to the fractured site in order to decrease the blood flow towards it so that the bleeding can stop. And then compression. Sterile dressing of the fracture site is important. Then there is elevation. We have to keep the limb elevated above the level of heart so that again the blood flow is reduced, in turn reducing the bleeding. Lastly, we have splinting. Splinting means immobilization of the fractured site. As we can see, RICE, R for resting of the limb, I for applying ice packs, C for we have to compress with sterile dressing and then elevate it to the level of heart. Also, additionally, we have to make sure that the patient's volume, vital signs and mental status are normal. We have to diminish patient's pain. How do we do it? By giving painkillers and everything we have in our power. Then, firstly, we have to give cold compressions. The cold compressions are to be given for the first 48 to 72 hours. Why it is done? So that the swelling reduces and also the blood vessels are constricted, minimizing the bleeding. Now, once the acute phase is over, after 72 hours, we follow up with hot compressions. Why? Because hot compressions promote blood flow to that area, which in turn promotes healing of the area. Next, lastly, splinting to support and restrict the movement of the fractured part is a vital part. So, here we see a table where we understand how much blood is lost in 2 hours from different fractured site. As we can see, for pelvis, it is up to 3 liters. 3 liters of blood loss. Similarly, for femur, it is up to 1.5 liter. For humerus, tibia, fibula, and then ankle and elbow, it is around 250 to 500, whereas radius or ulna, it is 150 to 200 ml. So, as you can see, the most important or dangerous sites for fractures are pelvis and femur, and the humerus, fibula, tibula, ankle and elbow, they are in the mid range, whereas radius or ulna is the least dangerous type of fracture. Now we move on to principles of splinting. So, before proceeding to how to splint a patient, we need to know certain principles which will help us through the way. First, we need to identify the fractured site. This is important. We have to identify the fracture site. Before identification, we cannot just splint the patient anywhere because it depends on a lot of things. Where the fracture occurred, are we covering both the joints on the two sides of the fracture or not? So, we have to identify the fracture site well. Next, as I said, splint should cover the above and below joint. For total immobilization, it is important the joint above and below the bone is covered. Next, bleeding control is priority. We have to cover the open wound with the sterile dressing before splinting. Definitely, we cannot just splint over a wound. We need to sterilize it first because we do not want any infections to be caused to the patient. Then we have to apply adequate padding on the fractured site. Adequate padding is important again so that the pressure is evenly distributed of the splinting and their additional injuries do not occur due to the splinting. Next, we have to check before and after. What? First, function, that is motor function we have to check. We have to see whether the motor function is working or not. Then we have to check the distal pulse or arterial pulse. Then we check for capillary refill. We hold the nail bed for a second and then leave it. If the blood returns in 2 seconds or less, then it is fine. Otherwise, there is a problem. And then temperature, we check the temperature of the skin, whether the patient is too cold, patient is too hot. What is the temperature of the patient? And then we check for sensation. Next, we do not push the fractured site. We do not push the fractured bone under skin. We do not attempt to do that because if we attempt to push back the bone, it might lead to further injuries. So, we do not attempt to do such things. Now, let's see what are the types of splints here. First, we have a rigid splint. What is a rigid splint? Rigid splints are used for fractures of long bones such as the femur or humerus. Okay, then there is air splints. Air splints means they are used for limb fractures and they are also used for various sprains. Then there are vacuum splints. Vacuum splints are used for limbs, especially in emergency situations. So, these are used for emergency situations and not an ideal choice of splinting. Then there is vacuum mattress. It is used for full body immobilization in cases of trauma or injury, in cases of multiple trauma cases or multiple trauma injury of the body. Then there is traction splints. Traction splints are used for femoral fractures and midshaft femur fractures, mostly they are used. Next we have buddy splints. Buddy splints are used when there is simple fractures or dislocation of fingers or toes. Sling and swath. Sling and swath are used together for the immobilization and support of arm, shoulder and elbow, whereas swath does support and stabilize the shoulder and upper torso. As you can see here, the rigid splint, it is placed and then it is tied around with the bandage so that the limb is placed in immobilization. Then there is air splint. Here what is done? The air splint is inserted to the broken limb and then there is an inflation valve through which we can blow air and make the compartment airtight and immobilizing the structure. Vacuum splint is similar. We wrap it around and then create a vacuum so that it stays in place. There is vacuum mattress, which is used in emergency setting when there are multiple fractures on trauma and it is not understandable which one to be managed first and the patient needs to be shifted to the hospital as soon as possible. So we just lift and keep the patient on the vacuum mattress and then we wrap the patient along the vacuum mattress, secure it and transport as soon as possible. Again, it is not an ideal choice for covering specific fractures, but in case of emergencies it is definitely helpful. The next one is a traction splint. Traction splint, what it does, it provides relief for midshaft femur fractures. It is good because it is providing constant stretching to the muscle, which relieves muscle spasms to some extent. Then there is buddy splinting. Buddy splinting is done when there is a one finger fracture or finger dislocation. So the finger adjacent to it is also splinted along with so that the movements can be restricted to the maximum. Lastly, here is sling and swath. So this how the sling is created, how it is done. So we can take a triangular bandage and put it under the affected arm and put one end to the opposite end of the shoulder and the other end lying down can be brought over the affected arm and kept on that same side of the shoulder, and then both the ends can be tied together. That is how it is formed. Then we apply the swath by stabilizing the fractured arm and the upper torso. So that is how the splinting, different methods of splinting can be used for different fractures. So what we learn from this are fractures are nothing but discontinuity of bone, which can be broadly classified as complete and incomplete fractures. They can be also classified as closed and open fractures. General assessment findings of fractures are usually pain, deformity, discoloration and muscle spasms, but also different kinds of fracture and severity might give some other symptoms as well. The general management principles revolves around fractures, sprains, strains and can be described by the mnemonic RICES, that is rest, ice, compression, elevation and splinting. So we have to maintain proper resting, proper ice packing, compression of the injury, then elevation from the level of heart and proper splinting method according to the type of injury. Thank you.